Boro Aboye, and welcome to Traditional Herbal Health. I am your co-host, Ifa Bemero, and this morning I'm going to read an essay, Ifa, from Oyeku Iwori. Oyeku spin here, Oyeku spin to the other side. The face of the Ifa tray becomes full to the brim. Cast divination for masquerade coming from heaven to earth. He was asked to perform sacrifice. Would life please me? They said life would please the masquerade, but he should perform sacrifice. The masquerade performed the sacrifice. He had rest of mind. He then started to perform wonders. Oyeku spin here, Oyeku spin to the other side. The face of the Ifa tree becomes full to the brim. Cast divination for masquerade coming from heaven to earth. He was asked to take care of the ground and perform sacrifice. Masquerade heard about the sacrifice and performed it. Offerings of sacrifice and free gifts offered to Eshu. Come and greet us with good tidings. One is usually found with good tidings at the feet of the king of all Orishas. Ashe. So that's the Kudu Ifa's reading for today. I will now
Ashe.
hand it over to the host, Dr. Ingrid.
Hello, everyone. So today I would like to speak about herbal mind and body code and how to stay in balance naturally through the various seasonal changes. And that's for the purpose of lasting health and especially peace of mind. There's a word that we use a lot when we practice Ayurveda or an Ayurvedic lifestyle, and that word is dosha. Many times, certain words become trendy, and we use them really without understanding what entails to the to the philosophy behind the word. So today, I'd like to speak a little bit about the doshas in Ayurveda. So they technically refer to our unique physical and mental constitution, which does influence our personal well-being. So each person has a dominant dosha or especially a dominant combination of either two or three elemental forces. So when you know yours, it can help you to maintain balance throughout the year or whatever transition you may experience. So, why are we speaking about this? All right. The herbs that we use, the food that we eat, the activities that we do are all have an effect on the balance of the dosha. So, for example, using certain herbs might actually create an imbalance within your specific constitution or your body, whereas somebody else might get a result. That's why sometimes you may find that an herb or a natural supplement may give different result in absolutely everyone in your family. Everyone may have great result and great satisfaction using that specific herb, that specific blend, or that specific supplement, but then nothing happens for you. Nothing is wrong with you, and nothing is wrong with the supplement, the herb, or the blend. It's all about your personal constitution. So, according to Ayurveda, the dosha affects every aspect of life, okay, and they play a central role in health and healing. So, they are the driving force within the body, okay, and that's what we actually call the driving force that dominate the body, that govern it. That's what we actually call the dosha. So, we are born with a unique balance of three, and it's like a fingerprint. So it's called your physical characteristic, your ability, your personality, your likes and dislike, and your susceptibility to various health issues. So the doshas are comprised of five elements: ether, air, fire, water, and earth. So we speak about the vata dosha, and this one is form of earth and ether, and is the force behind every movement of the body and the creativity of the mind. So, for example, if you may have like a vata imbalance, you may experience different pain within your body, okay, or stress, unable to think, a froggy mind, etc. A pitta dosha, pitta is form of fire and water, and that's the form behind all metabolic and chemical transformation of the body and the mind. So when you think about metabolic, you will tell yourself, okay, people who suffer high constipation have to focus on balancing their pitta dosha. And kapha is form of water and earth. It's the force behind the structure, stability, and lubrication of your body and mind. Um, there's something I didn't do. Allow me. Okay, so without any one of the dosha, life would not exist. Not only the dosha from the constitution, but they also regulate the function and process what takes place in your mind, your body, and your soul. So, when you get to know your constitution, you will identify with various characteristics of the three doshas. So, what does it? Why does it help to know your dosha type? When you know whether you are dominant vata, pitta, or kapha, then you can create a diet and a lifestyle that is personalized to you. So, um, when you have that focus in mind, for example, you will no longer have a focus on what do I eat to lose weight, what do I eat to have a greater energy, what do I eat to, or what do I drink to ease my stress. You always focus on keeping your doshas in balance. Once they are balanced, okay, it makes it a whole lot easier to just have a lifestyle of being happy and eating what's right for you. Okay, every herb is not necessarily the best for you. All right, or sometimes it's just a matter of knowing how to balance your plans. So with Ayurveda diet and lifestyle habits, they're just like medicine themselves. It puts you at the driving seat of your wellness and it helps you to become your healthiest version of yourself without necessarily relying every minute on having money to pay someone to tell you what to take exactly. So by the time you get to an herbalist or you get to a naturopath or whatsoever practitioner you choose to work with, you already have an idea of what's the best diet for you and also the herbs that are not working well with you. Because everybody does not work with Ayurveda, so an herbalist may make a suggestion to you proposing herbs that are not the best for your body type. However, if you know in advance, then you can always say, well, I would like to use a different herb, because this one does not complement me necessarily. So we're going to speak about them a little in detail, and then we are going to take an example. When the vata type is in balance, you are likely to be flexible, to be creative, and to feel enthusiastic. But with a diet that does not foster balance, a vata dominant person, for example, become fatigued, restless, and anxious. When it comes to the pitta body type or the pitta dominant body type, whenever those are in balance, those are people who are focused, they are assertive, they are very good leaders, but out of balance, the people become impatient, hot-headed, they quarrel easy, they have like the patient, patience is what lack definitely when pitta is out of balance. And now
Okay.
let's speak about the kapha type. When a kappa type is balanced, there are people who are calm and they are compassionate. I am a kappa dominant type.
Okay,
But
great.
whenever the kappa is out of balance, they become insecure and they procrastinate. And that's definitely something I have to deal with all the time, procrastination.
Okay.
So let's speak about qualities. Each dosha has distinct quality. For example, Vata is light, dry, cold, rough, subtle, and mobile. But Pitta is hot, It's light, it's penetrated, it's liquid, and spreading. People of the Peter body type are people who would easily sweat a lot, so they would have body scent more than others. Okay, and usually they would experience oily skin as well. And the Kappa body type is heavy. It's cold within. So, for example, people of Kappa body type should avoid eating too much raw food. We all have the focus that eating raw food is better because you get more nutrient in your body. It is true. But if you are a Kappa body type, you may want, for example, to supplement your eating um, raw food with drinking a lot of hot drinks, hot tea. So leave everything that is cold, no ice cream, no ice pop, nothing cold, privileged thing, drinks that are hot. Okay, and a kapha body type is soft, so like you would see the muscles don't really form so fast on a kapha body type. It's
Okay.
smooth, it's stable, and it's dense. So when you understand how this quality affect your mind and your body type, then you are able to align your activities, so and your habits and the food to foster a balance. For example, a kappa person is someone that should rise before the sun is up in order to be productive. So whenever the body is in balance, you will realize, for example, that a kappa body type is going to tend to wake up late. But once you wake up late, you're already out of balance for the rest of the day. Once you are dominated by the kapha dosha. Okay, so
Okay.
I give an example. During the week, I make it a duty to wake up at 3:45 a.m. 4 times per week, at least. So this way, I know that I'm starting my day when it is silent all around me. So therefore, by the time everybody else is up, I'm already up and running for a while. So nothing slows me down. But if I make the mistake, for example, to wake up after everybody else, there's already a lot of noise around, there's already a lot of movement, then it makes it difficult for me to set myself in balance. And I just use myself as an example. Okay,
Wow.
so this is why even in my practice, I also rely on the dosha body types to help people to target what herbs are best for them, not just in terms of healing plan, but also in terms of adapting someone's lifestyle. So I wanted to take an example to kind of illustrate what we spoke about earlier, and that's menopause. Okay, because every woman in life is going to go through menopause, but every woman come in a different type of dosha combination. So, for example, if we are experiencing hot flashes, the what we are going to do, we are going to ask maybe an elder or somebody who knows about herb, what do I take for hot flashes? And they will tell you you may give, at least 20 herbs. Take this, and this is going to help you with your hot flashes.
Wow. So many.
Now, I'm just giving an example. Okay,
Oh,
so now you may go through all of them, realizing that it's not working, or on the contrary, you realize that it's making it worse. Why? Because maybe the herbs that you were suggested are actually increasing your imbalance already and hence making your symptoms worse. So this is why knowing your dosha actually help you to make better choices and to choose better herbs to manage um, whatever you are experiencing. I don't like to use the word disease all the time.
okay.
So for example, the onset of menopause is when the menstrual cycle stops for a continuous term of 12 months and it does not reoccur. So you know that an entire 12 months has gone and then it's not coming back again. So therefore you may assess, okay, finally I am into menopause. Very
Okay.
often women would go into perimenopause, you would be like 6, 7 months, no period. And we believe that's it. We start experiencing some symptoms and hep, it comes back. So that's not it yet, you know. So, in terms of the dosha, a menopause is characterized by the aggravation of vata dosha. So, it's leading to an overall imbalance of the others also. And the signs, a general sign of a vata imbalance is dryness of skin, dryness of your hair, dry lips, dry joints. You would notice that your joints crack a lot. You
Okay.
would experience dryness internally, bloat, gas, constipation, dehydration, and weight loss. That's a general vata imbalance. In the mind, in terms of the mind, you will notice that you feel restless, dizzy, ungrounded. And in terms of circulation, well, when the vata is imbalanced, then you experience poor circulation, muscle spasm, uh, often asthma as well, or other type of respiratory allergies, and usually like chest pain. Now, when it comes to symptoms that are specific to a vata imbalance in menopause, now it's manifested in several painful symptoms, like the hot flashes you were speaking about, the weight gain, a lower metabolism, and cardiac activity. People would complain about palpitation a whole lot. I think that what people think about the most when we speak about menopause is a loss of sexual drive, or also the dryness in the vagina, or whatever bone and joint ache, also urinary incontinence and the night sweat. Okay, but there will also be other fluctuation because of the hormonal imbalance within. So when it comes to progesterone and estrogen and whatever mental fluctuation, because now the outside factors like stress, lifestyle are going to prompt more instances of mood swings, even depression or fatigue, because it's just hard to cope with external factors when there's already this war going on inside of your body. And
Okay.
usually, why it is difficult for women is because we remain obsessed in trying to, or maybe we are not prepared. Let's put it this way. Whenever it happens, we have not yet prepared in our lifestyle, in our daily routine, our careers, our taking care of children to slow down. So therefore, we keep forcing our body to try to function in an overdrive, and it creates, even further complication within. So, according to what's a woman dominant dosha combination prior to menopause, then the symptoms are going to, and the imbalance is going to vary, it's going to be different. So, some are going to experience, like, especially mood swing and hot flashes. Some might be constipation or irritable bowel syndromes. Okay, some may
Yeah.
not experience vaginal dryness, for example. That's according to what's the second dominant dosha. So this is something I try to educate my customers about a lot. So therefore, they don't feel that they must depend on me for everything and that they must have money for everything. So I think that educating people help them also to give them a greater control of their health, okay, and also establish a greater sense of trust. So they know that once they cannot manage it on their own, then they will know that they need to call and reach out for help. So I'm gonna give, for example, some of the since I chose to speak about menopause as an example to the importance of knowing one's dosha, I will just take the chance to give the various symptoms manifested of an overall menopausal imbalance according to the dosha. So I'm going to speak about the kapha first because that's my type. So in menopause, a kapha woman is going to experience weight gain, where others are going to lose weight. Then a kapha woman is going to put on weight. Okay, she will have a lot of fluid retention. So sometimes it may not be fat, but a lot of oedemas. So a lot of water retention. So
Okay.
drinking something that helps simply to a diuretic, something that helps to flush the liquids, sometimes it's just sufficient, and you realize that you may think I'm losing weight, but usually you'll be losing water. Okay, a kappa
Okay.
woman is going to experience more depression, more greed. She'll eat more to compensate the depressive feeling.
Okay.
And she may also have a little more high cholesterol during that time of her life. And the way to compensate is to use herbs and to use the foods that are going to keep the kapha down in balance. Okay.
Okay.
A Pitta woman, for example, is going to experience hot flashes, irritability, heavy bleeding during perimenopause, and skin rashes or other skin infection and disease, anger, irritation, jealousy, criticism, competitiveness, high blood pressure, and eventually heart disease. And the Vata woman now is going to experience mood swings, scanty bleeding during perimenopause, and those are the one experiencing constipation and irritable bowel movement. A lot of anxiety, worry, fear, difficulty in concentrating, and reduce libido. And also, those are the one experiencing bone loss. So, for example, I would say that for other members of the family, when you are aware of those things, it helps also to be more compassionate and to keep an overall external balance also, so that the woman experiencing menopause is better able to focus to what's going on within her body.
Okay.
Although today the focus of the discussion today was more lifestyle management, um, I can still name a few herbs that can help during menopause, and one of it is sage. Okay, and sage it helps a lot with the hot flushes and whatever night sweat. As well as chasteberry berry. Some people call it Vitex or Agnus castus,
Yeah.
and that's great for breast tenderness and the mood swing and the irritability. And sandalwood for anxiety, stress, depression, and even disturbed sleep. The devil claw or turmeric for painful joints. Sea moss to maintain a healthy weight. I said maintain a healthy weight, not to lose weight.
Okay.
And ginkgo for poor memory or ginseng as well. So I purposely just name a few general adaptogen that can be used for everybody. But again, for example, at a specific time of one's life, like menopause, it is better to actually target your imbalance by what you eat and by your lifestyle. So know if you need to sleep more, if you need to eat more raw food, if you need to eat more liquids, if you should abstain from liquid. You know, in the Caribbean, we love a broth and we love a soup.
Yes, we do.
And people who retain liquids should not really indulge in broth or in soup. For example, people who retain a lot, the Kappa woman should not have those heavy soup pot that we have on weekends in particular, or a lot of provisions, for example. For those like me who like provision, you know, you have to maintain, you have to just select what you eat and how you eat it. So it's not about abstaining from certain food, it's about balancing it and know how often you should have it in order to feel better and to be in the best of health. Voila. So how can you find your body type? Very simply, according to whatever language you speak, you can go online, you could find it ready-made, or you contact a practitioner who is able to guide you through it out. Or you can take the test, for example, and then the next time you go to your practitioner, if it is someone that's also sufficiently knowledgeable about Ayurveda, then you may want to start the consultation by identifying your dominant dosha.
Okay. Well, yep. You know, you hit me with a lot of stuff there tonight. I don't even know where to start, but I have quite a few questions I want to ask, right? The first thing I want to ask is about your example. You mentioned menopause, right? Now, I know right off that menopause is a very difficult time for women, and there are
Definitely.
so many. I think what I've read is there's like 200 and something symptoms that are associated to menopause. So menopause is something really, really difficult
Very
to
important.
treat or to sort of deal with from the perspective of addressing symptoms. Um, we know that basically it has to do with the decrease of hormones in the case
Yes.
of women. However, I noticed you sort of was able to narrow down the symptoms to particular types of
Yes.
doshas. Now, tell us a little bit about how are they really able to sort of figure out the specific symptoms that would occur in a particular individual with a particular um, dosha. I mean, is it a matter of your blood? Is it a matter of the shape of your body? I mean, how
No.
exactly do you categorize or classify these different doshas or vatas, as you
It,
mentioned?
the doshas, they are in like Ayurveda is an ancient medicine. So the foundation of Ayurveda is recorded. Okay, well, let's speak about it while we're at it. Ayurveda is not just like a medicinal system, it's also the balance of your mind and your body. So therefore, also it comes with spirituality and it also comes with lifestyle instead of the sister science that is yoga. So those dosha combination and so on, those are inherited from the Vedas. So those are the tradition by all the scientists and herbalists that came all the years from the heritage of the ancestors. So back then, when they were assessing, they assess a lot on observation, experiment, and therefore everything has been coded. So people who have become BASM, the doctors who are medical doctors trained in specific Ayurvedic medicine, they're also able to do surgery. It takes 4 to 5 years to complete that, just one bachelor degree, much less for the rest. Okay.
Wow.
And they operate a lot on like modern science, but everything the modern science that is applied is derived from what has been inherited from the ancient wisdom.
All right.
So based on that, it makes it easier now to not even try to question whether it's right or wrong. And for example, me, even if I'm not like a specific Ayurvedic practitioner, because I am more based on ethnomedicine, but being a Creole-based person, our constitution often also include Indian heritage.
Okay.
So therefore, I extend it also to my practice, even if most of my customers are not Indian, but a lot, have a lot of like even if it's just a small percentage of Indian heritage. So we
Okay.
apply it to the body type, and it's not something to question. It's like you are given a manual to function, and you work along with it.
All right. So what I'm getting from what you're telling me is that this approach seems to be what is called a holistic approach,
It is
because you're
indeed.
saying that it is not just a matter of a person's physical makeup.
No,
It incorporates also psychological traits, etc., etc. That's what I was just getting from what
definitely.
you're saying. So the question is now, because it seemed to be a very sort of a specialized approach. It doesn't seem like, you're going to treat every person in the same way, like it's one size fit all sort of a thing. So, then that would lead me now to ask um, the various profiles, because that's the only way I can figure out to frame what I
Mhm.
want to say, right? Because based on the dosha and the vata, you are able to sort of categorize an individual and sort of figure out exactly, well, again, you just explained is a holistic thing, so you could evaluate the psychological traits. You could look
Definitely.
at the person's behavior, their attitude, and these sort of things. And earlier you mentioned a thing about a person's diet also
Yes.
being a part of their medicine. So now let's go a little bit into that and try to figure out how it is that, per se, I come to you and you tell me, well, you shouldn't eat this and you shouldn't eat that because these are the things that is having this effect on you. Now, I'm going to be sitting there and I'm going to be like, oh, how she arrive at that? I mean, she has been diagnosing me. We've been discussing, the symptoms that I'm having. We've been discussing the things that I'm eating. But what is this some kind of magic that you could tell me? Well, maybe you need to leave this out your diet. You need to leave that out your diet. How does that really work?
To be honest, I do have a lot of people who are having like this this kind of skeptical approach. And for example, I experienced that this week. Um, at the end of the year last year, for example, I designed some specific blend for um, kappa balance doshas to lose weight. And so, knowing how everybody wants to rush and buying anything that is strong to lose weight, I ensure that I label those products with the kapha symbol because it is specifically for people who are deep-seated kapha imbalances to lose the weight. So what happened? A lot of the people who I know are, have that kind of imbalances purchase and they got great result within 2 weeks. And then some other people now, which I know do not have that type of imbalance, I told them this is not the right blend, but I can afford to buy it. And if it's working for Peter, for Paul, and for Jack, it's going to work for me as well.
Okay.
No problem. Your purchase. And what happened 2 weeks after? I realized that I'm more regular. I'm going to the bathroom. I have more energy, but I don't think I lost that much weight. Why? Because the blend is not complementing that particular imbalance that this person has.
Okay.
So sometimes what happen is that when people choose a practitioner, usually you choose a practitioner that you can actually trust.
Okay.
So the person could guide you. If not, you use your own judgment. Or if not, what happen is that sometimes people challenge you. They do things on their own way, and when they realize it doesn't work, if they remember that you had advised them already in advance, then they would come back into you and say, I realize that what you said was right. Okay, so what should I eat now? And that's the way it has been
Yeah,
happening.
but isn't that a little bit sad? I mean, I've had that experience in dispensing herbal medicine lots of times where you tell the patient, okay, when you get up in the morning, you take 10 mLs of this, and then before you eat, you take another 10 mLs, and before you go to bed, you take another 10 mLs.
Mhm.
And sometimes the patient say, you know what, I don't think I can remember that. Huh? I say, no, well, it's written on the bottle. But the next time they visit you to from the time they start off with that thing, I don't think I would remember. You already know, look, that's heading into problems. So the
Mhm.
next time they come to see, how you doing? Have you gotten some relief? Well, no, not really. Were you taking it first thing in the morning as I recommended? Did you
Mhm.
have it before lunch? Did you have it well, that was really convenient for me. So what I do is I take one big dose lunchtime and everything except what you told them to do. And then some people have the nerve to say, well, the medicine not working. So
Yes. Mhm.
now along this vein now, so now I'm gonna ask the general sort of medical guidelines that exist for patients are normally along the line of diet, exercise, and in the case here we're dealing with herbal medicine, and in
Mhm.
some cases alternative treatment.
Yes.
Does the treatment for patients along the line of Ayurveda normally follows those four principles or four essentials rather?
Well, definitely that is why yoga is so important. Now, if you look around the world now, or maybe you could just take Google, because Google is gonna take us around the world in seconds. You would find so many Westerners who are Ayurvedic practitioners, Ayurvedic consultant, and you would wonder, for example, I am French, and in the French system, one like usually they would just remove God or anything spiritual out of anything that makes sense. And I hope I'm not offending anybody. I'm just sharing my opinion of what it is to live in a French society when it comes to spirituality. But yet you would find so many people even in France, mainland France, or other islands, who follow this Ayurvedic lifestyle. And usually, how did they get there? They got there because they became interested in yoga. Yoga, at some point, everybody used to think that it was devilish. Sorry. And then it became a trend because people realized that it gave them a lot of physical well-being and a lot of a well-being, mental well-being as well. Now it is a balance. Yoga is just, one hand, and you need two hands to make the clap. So usually now they began to adapt their lifestyle by learning the doshas, and that's where it begins. So for example, in my own journey, when I started to study herb, um, I had a specific religion that I choose not to name. And when we started to study yoga and we went into exactly the doshas and the science of it, eventually at some point we touched the spiritual. And that where the transformation began for me, because if we go deep into the herbal healing, certain herbs definitely put into a particular deity, a particular, etc. So there are certain incantations sometimes that I use to
Mm.
use certain type of herbs. And you would wonder about how did a person, for example, who came from a background of zero spirituality, not believing in God, get into becoming an Ayurvedic practitioner? Well, usually you start with one path, and all of us are going to approach this from different perspectives. Some come in terms of diet, some comes in terms of sports, so they end up into the yoga, and some come for energy, some come for balance, some come because they had like maybe a depression, whatever emotional imbalance, and they come around Ayurveda around this time. So you would find that many people nowadays practicing um, like a spirituality that is close to Hinduism, but in Hindu, like the spirituality in India is so um it's wide. It's like a whole world on its own that usually you never become really a Hindu. You just like have a lifestyle including a certain amount of spirituality from whatever you have learned. So it's really like it works on the mind. So not just the mind in terms of feeling good, but also on the mind spiritually, on the body physically, and also in terms of adjusting your environment. So that would include movement, sports.
All right. Well, to some degree, some of the things you mentioned sort of remind me of Euphoria. Because, for
Definitely.
example, when you go and you have the IDAFA done, normally they're going to talk to you about, sometimes your conduct, your behavior, some psychological aspect of your life. And it
Mhm.
also, in some cases, is going to give you what we call taboos, which is more or less, in some cases, dietary guidelines of specific things you should not eat. Also, an aspect of the tradition covers the use of specific chants sometimes when we prepare medicines.
Sure.
So it clearly reminds me of that. But then, this brings me now into the other question that I'm going to ask, um,
Sure.
which you partially answered already because you mentioned the fact that things like meditation and yoga, which is part of the solution also, that even shows that the entire approach is in fact really holistic. But I want to delve a little bit into the field of exercise as it relates to body types and specific symptoms and health condition.
Mhm.
Myself, I had a back injury many years ago, right? And over the years, in coping with my medical condition, I applied basically all three of the basic rules that we normally apply in medicine, which would be diet, exercise, and health, right?
Mhm.
But what I've learned on the journey in educating myself about, coping with pain and various syndromes and other symptoms that are associated to spinal injuries, I've discovered that your spine on the whole, the various centers in the spine, which is like a double thing here, because now we could talk about the energy centers that are located, the seven major centers that are located in the spine, as well as now you could also look at the various bones, the vertebrates that make up the spine, and
Mhm.
their role in being the origin of most of the nerves that feed the various organs in the body, etc., etc., etc. So,
Mhm.
what I want you to talk a little bit, some of the about is some of the exercises, the yoga exercises, the postures, and the
Mhm.
various things, the role that they play in influencing the function of your body organs and system, and how it can be applied in bringing about some sort of relief to particular physical manifestations of what we call symptoms of sickness.
Okay. Um, this is directly associated, for example, with what we call in a more modern science, reflexology. So the body is organized in different zones. So according to which zone you stimulate. So for example, let's say you're having an imbalance in your eye over here, there will be, nerve associating passing from your eye going all the way down to a different nerve ending in your hand. I'm using the hand for example because we can treat reflexology from the hand. Okay, so according to what stimulation you may give of the hand, then without touching the eye or without touching what's happening within your eye, you may access whatever blockage or nerve by pressing the right endings in the end. Okay, and that's both side of the end. And the end is just an example because we also I'm trying to get the right word in English, cranial massage. So you will
Okay,
find
yes,
that
yes.
some practitioners, for
Cranial
example,
massage, that's exactly what it's called.
cranial massage. Okay, so some people are going to access that, for example, by targeting the head because they are not comfortable using the hands, or sometimes just because it's not necessarily like sometimes they can use whatever, whether the head, the hand, or even the feet. um Often it's not often we don't really work with the feet unless you go to a particular center, you've gone for other treatments, so we've done some work to your feet in particular, so now your foot is prepared to be able to work on. But usually when you just hop in for some like a quick treatment and so on, your feet are not relaxed, so we don't work especially on the feet. So now that brings me also to speak about acupressure as well, or digital acupuncture,
Yeah.
but also the cupping therapy. So
Okay.
all of those therapies are used to really stimulate the chakras also, because those are the energy centers, okay, to address blockages, okay, by using either it's through massage, so through touch, uh, it is by using the needles, okay, or it could be also by using the cup to actually like remove the blockages and allow the energy, the blood, etc., to flow better. So now to apply that to yoga, for example, and not just yoga. Sometimes we have the very just like mudra. People will tell you, okay, if you touch those fingers, or if you do this particular touch, or in even in the yoga, like if you stand in a particular position, or if you point to that direction, whatever. And so people would wonder, what kind of mockery is this? It's not mockery. It's like when you take a particular pause, or when you stimulate your body in a particular time, you are actually stimulating what's happening within your body. So therefore, you're allowing the energy to move a whole lot faster in a particular area of your body. So yoga is a lot of that. So without having to go and do um, a lot of tumultuous exercise, a lot of sweating, running, which is good also. It's very good. We all have to be, we all have to move. You will realize by doing those other mild exercises, you get back to your health, and that's especially great for the people who, for example, who have suffered back injury, or not just back, because cervical spine also. People who have difficulty moving, they find a lot of healing by using those exercises that are mild, but they are specifically targeted.
All right. Well, I mean, you covered quite that. That was a very extensive thing right there. But I mean, I know that they use the feet, they use the ears, they use the hand, they use the skull. With the various modalities of traditional treatment. All
Mhm.
right. Now, so we've covered herb. We started out with some herbal examples for the case of menopause. We just went into exercise. So now let's talk a little bit of the dietary approach. Now, I know, for example, in Ayurveda, you deal with specific tastes. So you might want to talk a little bit about that. And after that, we could just talk about nutrition in general.
Okay, so what I like about the taste in Ayurveda is especially when we speak about bitter food, because once we start speaking about ether, then you would find a lot of people, according to their overall knowledge, to tell you that in their specific book of life, it is said that you have to use bitter food, so they take you on per se. Okay, but it's not just like bitter food that are good for health. I find that some of my customers will tell me, "Oh my goodness, this is too bitter. I can't have it." But sometimes, according to whatever they are experiencing, that's what they need. Okay, so for example, um, you would find like the sour taste, I just speak sour. It's more for people who experience a lot of earth and fire within the body. So it will, for example, it will help to decrease whatever vata imbalance, but to increase the pitta and the kapha. Okay. So we speak about sweet food, we speak about sour food, we speak about salty food, we speak about pungent, astringent, and bitter. So for me, like, um, for example, I am not Indian, and it shows. I'm not Indian. So when I began studying, all of those things were like brand new to me. I asked myself many times whether I chose the right course, but we all have to start somewhere. And when I think about astringent, I think a lot about I'm trying to remember the name right now, but I think a lot about Hing, asafoetida or asafoetida. I think that's what most people call it.
Yeah, asofecita.
I used to wonder, but how can people eat this? How can people put this in there? Because just the scent of it is so strong that for me it was something that was unbearable to eat, to smell, or to use in any type of treatment. However, when you allow yourself to be taught and to be a little wiser, grow a little wiser, then you realize, the value of having a pungent food in your lifestyle and what it can do to balance your dosha. So it makes it easier to overcome maybe the scent, the taste, and focus on the healing.
Okay.
So when you have a balance of the six states in your diet, it creates a harmony within your body and your mind. Okay,
Okay.
so that's another thing that people can do is just when they create a plate of food, especially people who have a heavy plate, they need to see a lot of food in it, is to focus on having all of those tastes present, and then you would know that even if the plate is heavy, you are not technically harming yourself because it is balanced.
All right. So you're saying basically the key to the Ayurvedic approach to
Mhm.
eating and diet is basically taste using the different flavors that you just mentioned.
Definitely.
All
So
right.
it's like, yes, some of them, like some of those states are going to be aggravating. so causing imbalance definitely. But aggravating is that you are going to experience symptoms where you are not feeling okay, for example. So, for example, if you are a Peter type, which means that you there's a lot of fire inside of your body, you should probably not eat too much of curry. I'm just giving an example. Not too
Too
much of
much heated
pepper,
food. The food must
too
not
much
be
heated
heated.
food. Exactly, exactly. So, or for example, if you are a kappa person, then you cannot drink too much of liquids, especially like avoid cold stuff and avoid the sweet. The sweet is very aggravating to the kappa people. But you would find that kappa people always like to have something sweet. Like some of the grannies, they would have their cup of tea in the morning that was like sacred.
Well,
But your
I am now wondering if I am that type because I have a sweet tooth to myself. All right, sorry, go ahead.
they sometimes like we take something that's good for us, but the amount of sugar, and so it's like it's killing the purpose of not just the herb, but it's like the herb cannot even perform within the body
Mhm.
because the sugar taste is aggravating to one's balance or that specific balance.
All right, though. Now we have roughly like about 8 more minutes, but we could probably. Well, I know you're pretty good at it. You just gonna sum this up in a short little space of time. All right, so
Hopefully.
we spoke about the Ayurvedic approach to diet. So
Mhm.
and you says the main key to it is balance. So now we're gonna talk about the sort of modern approach, how it interlocks with the Ayurvedic tradition as far as like the basic stuff is like, you need to have some vitamins, you need to have some minerals, you need to have some trace elements, you need to have carbohydrates, you need to have fats, you need to have, so I would like you to talk a little bit now about nutrition in general, but you can show where it links or locks into Ayurveda.
Nutrition in general from also from an Ayurvedic point of view. Hello?
Yeah, definitely. When I say, well, not really from an Ayurvedic, but I know there are certain aspects of modern science and modern knowledge that is
Okay.
useful and compatible to
It,
the science of Ayurveda. So that is why I want us, like they would tell you, well, you need to have between 3 to 8% fat in your diet. You need to have a certain amount of protein,
yeah,
etc. That type of thing.
now, I I understand. I understand. To be honest, it's like when we practice alternative medicine, or let me say alternative type of holistic healing. Because for example, where I am located, we're not allowed to speak about medicine per se. Anything that we offer the customers is in terms of complementary therapy or even in terms of nutrition. So we cannot say that what we are given by science is not good. On the contrary, we have to look at it to ensure that we bring ourselves, we use wisdom into choosing what we want. But usually, when people come to a natural health practitioner, whatever the specialty is because usually those daily guidelines that we have applied in our body, we realize that we are still out of balance. So, for example, I would say that when you go to somebody who focuses on natural health, you actually is because you want to give yourself a wisdom. So therefore, when you go to such a practitioner, a lot of the interaction is educational because you are going to be advised on what's best for you according to tradition or according to science. You could just go directly to your medical practitioner. You do not really need to go to a natural health for medical approach or for a per se contemporary scientific approach. So I would say that personally, me, I promote the wisdom of our ancestors. Why? Because the different imbalances that we're experiencing now, they barely used to experience that then. And whenever it used to happen, it was never as heightened as what we are experiencing now, because the food that we are eating now, that's not the food that they had then. The food was more whole, it was there were more nutrition, there were no pesticide, less
Yeah.
chemical
It was
overall.
organic. Basically, they had organic food. We now have to deal with the GMO and the GE and the genetically modified, genetically engineered, all that sort of thing.
Okay, so that is why now what I'm saying is that I encourage people, to eat according to their dominant dosha so that they could keep the energy moving. Once you have enough energy in your body, you are going to be healthy. Okay, and so it may mean, for example, that maybe you are not using the same vitamin from other people, or maybe you focus more on minerals and you focus on vitamin, but overall the focus is balance.
All right. Well, Doc or Dr.
Mhm.
Ingrid, as usual, you're always so well prepared and provide so much information and so much learning. I am sure that the viewers would have enjoyed and would have gained the great benefit from tonight's program. At least I know I have,
Thank
and
you.
I would like you now to tell us, your platforms, products, anything of the sort that you may want to talk about. We have 3 more minutes, so we are about to wrap up. So tell us about your platforms and maybe products if you want to.
Okay, so the platform usually is Ear Sankofa or Bell Sankofa. That's how you would find me on Instagram or on Facebook. There is a name YouTube channel that's Ear Sankofa, and I have appointed someone to help me to manage this. It's like on the phone it is set, but honestly, this dog is not very savvy in terms of computer.
Okay.
So you will notice that most of those videos are going to be uploaded throughout the week, all of them back to back, just because I had an issue managing that. But you can find me also in on my Facebook group. That's Alkaline Lifestyle and Creole Remedies. You will also find me at Belsanko from Herbals. Those are the supplements that I develop. So I do have specific general formulas, but I also like to create specific blend for my customers. So usually it goes for a consultation, and then I will prepare what works for your specific dosha combination, we will say. Okay.
All right. Well, the videos would be available on platforms such as the IFA Orisha Tradition Discussion Group of Trinidad and Tobago, the IFA Orisha Institute of Sacred and Divine Sciences. It would also be available on IFA Bemero, home of IFA Orisha Tradition. It would also be posted on the Grassroots Education and Entertainment Network. It would be posted also on the Orisha/Baptist Teaching Moments. It would also be able to be viewed on the IFA Orisha Community Congress, the Omo Orishas of Trinidad and Tobago and worldwide, the Orisha Devotee Discussions, IFA Orisha Events of TNT, etc., etc.
Yes.
What we would like you to do is when you visit these platforms, we would like you to like, subscribe, as
And share.
well as share. And with that, we would like to say Odabo and see you on the next program.
Double.
Odabo.